Welcome to another Functionized podcast. This is your mad scientist, Jim. I call this one a very special one as we had the entire Functionized team here with us. We've got Beauty Brains Braun, Chantea. We've got Dr. Mike. We have Dr. Dan. Everybody here at Functionized. And today's a very important topic. It is sports performance after concussion. All too often, individuals get a little bonk on the noggin. It can be years ago. It could be very traumatic and very recent. But they believe maximum therapeutic benefit has been achieved when it has not. And just because a doctor tells you, yep, everything's fine, doesn't necessarily mean everything is fine. You may still be getting symptoms of headaches, nausea from time to time, forgetfulness, just total fogginess. And this is not normal. This is not something you had previous to concussion. We did a webinar yesterday on it, and it is currently posted right now to Facebook, and definitely make sure you check that out if you want to see us live. I do apologize ahead of time for the quality of audio as it was done on Facebook Live. However, the quality of the content, it's what's inside that counts, is what you're getting here, and the quality cannot be missed. This is just such a vital and important webinar that was done, and I urge you to pass this podcast along to everybody that you know with children, somebody that is school age. Pass it on to school administrators, pass it on to coaches. Let them hear this important webinar delivered to you in podcast form. It's just I just can't get through how important the information is here for you. And most of all, the information is free. Take a quick moment and screenshot this podcast and tag us at Functionized, at FUNCTIONISED. We'll sure to get back to you. Random winner every single week is given a free t-shirt. Compliments of Team Functionized. Remember always to live functionized. So without further ado, let's get on with this podcast webinar.
Welcome everybody to the Sports Performance After Concussion webinar, presentation, podcast, live Facebook feed from Functionized Integrative Therapeutics. I am Chief of Human Performance, Jim. We're joined by
the Director of Cognitive Performance, Chantea.
I'm Dr. Mike, chiropractor and functional.
I am Director of Nutrition, Dr. Dan. So welcome everybody. If you could do me a quick favor and just type in yes into your box. Just let me know that you can hear me. Okay, great. Thank you so much. All right. The topic of concussion is a growing topic. Concussion, a lot of individuals are undergoing some difficulties, especially later in life, in recovering from concussion. And unfortunately, a lot of individuals seem to have a lot of their lives that are being stopped and altered because of these events. And we get bumps on the head and don't think twice about it. But when it really boils down to it, people are getting headaches and can't explain it after concussions. People are having cognitive difficulties, can't really explain it, and they're not going back to, oh yeah, I bumped my head. A few months ago, doctor said I was fine. I reached maximum capacity of recovery.
There's no more pain, so they must be fine.
Absolutely. And that doesn't seem to be the case so much, does it?
There's a lot of lingering problems.
Correct.
There's a lot.
Significant. And they can vary greatly, so it's not like there's one formula to know if you have these symptoms. You had a concussion 5 years ago. It varies very much individually based on where your event is at.
When it comes down to just even definitions of human performance, I'm the chief of it, right?
You are.
Thank you. When a human is observed under a particular condition, that is their performance. functionize like to optimize this function under particular conditions, to raise your abilities to a higher degree. And if you're getting headaches, if you're sleeping too often now, if you are having brain fog, mental difficulties, then
Troubles in school.
absolutely, there are ways to get ahead of this. And that's what we are 100% here for. So, back in ancient times, go back to the days of the Romans, horses were actually fed mushrooms, and it was believed to make the horses run faster. And mushrooms?
We don't know.
Gladiators suggested herbal amphetamines to make their fights more spectacular, get them all jacked up and amped up. And we haven't really evolved too much further than that nowadays.
You're still taking amphetamines.
In Olympian time, Olympians, Galen, as we all know, as you all read about here, prescribed rare foods of an Abyssinian ass. They ground it up, boiled in oil, and flavored it with rose hips and rose petals to improve performance.
Nice.
I haven't seen that on our shelves lately, but Galen said it was good.
We must use it then.
Right. Ancient Olympic athletes attempted to boost their performance by eating sheep testicles. And that was a prime source of testosterone. If it produces it, you eat it, therefore it must become you. One of the factors that led to the dissolution of the ancient Olympic Games was overwhelming use of drugs, particularly the use of pharmacological agents, extracts, mushrooms, plant seeds, and it doesn't really seem like
Much has changed, right?
so. Same thinking, same results. When you break down performance, we can break down into visceral, metabolic, cellular, musculoskeletal, neurological, and cardiovascular. So everybody's expertise here, everything that we do here is covered into all these different components. In the neurological components,
That can be myself and Dr. Mike with that. So the brain is the central component of all of your performance. When it gets damaged from a concussion and you're suffering from post-concussion syndrome, you may find yourself sluggish, your reaction times are slower, your processing speeds, your visual acuity, all of these things change and decrease after a concussion. So in hockey, one of the main issues is your visual perception, the peripheral specifically. When you get hit in the back of the head and you have that, reaction front to the back of the head, it really does impact that visual connection. So you are now missing shots that are coming from the corner because you seriously cannot see them anymore. And unless you're training and having, ocular motor training, you are not necessarily going to see improvements from a concussion in that aspect. One of the things that we do here at Functionize is we integrate different modalities, including biofeedback, neurofeedback, audiovisual entrainment, and Bellevue, which is a BEMF device, to enhance the cellular function of the brain. It allows it to function the way that it should, and it helps recovery time from concussions.
when it comes to performance, there's different levels of performance. Mental performance, cognitive performance we're talking about here. The least functional, and I'm not sure if you smart out, but is if you're dead.
Fair enough.
Brain's not working. Very fair. Coming up, performance, unresponsiveness, minimally aware, minimally awake. Then we start getting into Alzheimer's, dementia type patients. Then you have the average concussed human. So we're still, the average concussed human, next step backwards is somebody with dementia. ADD, ADHD, dyslexia. Then you start getting to the professionals and elites. So from being deceased to elite, being concussed, you can still go either way. And individuals who have suffered from concussion have been shown to start having the plaquing, the neural plaquing,
Yes.
that does lead to dementia. And it's also been shown that it can be reversed. But there's a lot that goes into it. You can't just sit
There's
around.
many ways to help reverse, and psychophysiology is being very much researched right now and having significant differences in the aging process of the brain and reversing that plaquing by engaging your cognitive faculties more consistently.
It's one of those things that the earlier it's done, it's better. I mean, thankfully we're knowing more and more that concussion symptoms can become or recur or last for 10 years afterwards. And then you have people like, at least I know specifically that have gotten concussions, and there are signs that I see that are coming up, like balance issues. And it's really important to make sure you get them now before you do get diagnosed with something such as Alzheimer's. So you got to attack it. Not quite preventatively, but as soon as you know the problem arises.
I agree. I've had 7. One concussion. I was playing football on a tennis court, and of course we didn't have any equipment on. Why would you? You just don't. So I did catch a ball going over the middle, and I got tangled in the net. Because the net was up, and guess what? I flipped. And I was young. I was maybe 10-ish, and I hit my head, but I did hold on to the ball. I did. And to this day, if I were to hit my head in any way, I could be underneath the deck, cleaning up or whatever, and if I quit moving, I hit my head, I get silly. I call it being silly. And it lasts for several days where silly, if you will.
You're predisposed to
Correct.
more significant.
I think once you get one concussion, you're predisposed to have more and worse.
There's second concussion syndrome, which comes after if you sustain a concussion
Yes.
2 weeks from your first concussion, and then that really does compound the severity of your concussions.
Yes.
There's more research and paradigm shifting. They always said stay in a dark room and don't use your brain after a concussion. Well, more research comes out that especially with athletes, if you're not engaging your brain, your performance is going to decrease that much more. So using something like heart rate variability training, biofeedback, where it's monitoring your brain patterns and your heart rhythms, it can help to improve the recovery by allowing more oxygen to the brain. That's going to help reduce the inflammation caused by the concussion.
When it comes to neurological function, there's different components. First, you have to perceive something, to notice it. Then, mind must say, it's got to interpret it. With all the external forces in the world, all the different factors, all your senses are then taken in your mind that has to turn into an electrical impulse and send that impulse so some other part of your brain can tell you what's actually going on. Then there's the reaction. We'll say your body, you're feeling heat. It goes into the brain, interprets it, sends it back, and you react by pulling your hand away from the flame, hopefully. And that pulling away is the full execution here of that. When individuals are concussed, it interferes with this process, interferes with one or more of these patterns of it. And this is where physical performance, as we're talking about today, ultimately sports performance, definitely comes into play.
Reaction times are slower, which puts you more at risk for further injury if you can't get out of the way when you're supposed to.
Different ways here to improve upon sports performance. First, you got to understand how the athlete perceives the entire world. Assess their senses: vision, olfaction, hearing, taste, proprioception, vestibular function. Assess reactions, reflex, both autonomic, balance, gait, vestibular. And this is all where baseline also comes into play.
Yes.
To have that annual physical, and not just the quick.
Right.
Right. Yeah, I put the stethoscope up your heart. I barely hear your heartbeat. I'm moving on because you look healthy enough to me.
Right. Or I'm going to go like this real quick, finger to nose. Okay, you're good.
Exactly. We using some equipment on the balance tracks here that we have. Right. Doing the baseline concussion screening, doing a proper eyes, ears, nose, throat,
balance. Just
previous
Right, the proprioception and the vestibular is very important. It's very important.
Now you know where the athlete is both as baseline for twofold. One, obviously our conversation today, if they have concussion, we now have the baseline of getting them back to at least those factors. Or performance enhancement, they work their tail off every day. We can see the progress that they make as well in all these aspects. Even based on concussion tests, we can tell different deficits, right?
Absolutely. Pinpoint specific factors that are impacted from concussion.
So we also want to understand how the athlete interacts with the entire world. Evaluate pre-programmed movements, KDs, optokinetics, volitional movements, visual, target holding, eye tracking, timing, coordination, dexterity, reaction time. These are all things that we can quantify and do in the office. It's simple to do, but so necessary to understand how the athlete is reacting and potentially even tell if the athlete has had a concussion in the past. They may not be performing where they could be and undergoing the proper protocols. It's amazing that all of a sudden they become far better athletes, not realizing when they're 3 years old or held in a bunk bed is keeping them back. Examine how the athlete's processing the entire world. We evaluate cognition, do some digit symbol matching, trail marking tests, short and long-term memory tests, choice RT, evaluate emotion, which is a big one.
Yeah, and all of these we do here have very extensive neurological testing. It's all computer-based, it's very interactive, but it gives accurate results as far as what cognitive deficits have been affected. And then it lets us know, working through a treatment program, doing a retest, how much improvement there's been. So now you can get them to the field quicker and not before they're actually ready to go.
And it's amazing, even when I took the baseline concussion, I think I'm about due for a retest.
I think it's a year, yeah.
On certain areas that I'm fine and strong in, and then others is some of the geometrical shapes and remembering those, for some reason, my mind is not functioning properly. Think back, I've been hitting heavy baseball more times than I can count. In the 6th grade, I ran to bleachers head first, and saved basketball. And if anyone's listening to this, they probably remember my mother running the bleachers across the court.
And I think the important aspect of this is to get that baseline done, right? Right away. I mean, if you are in a sport and you're playing football, baseball, hockey, basketball, soccer, if you're an athlete and you're younger, and you should get that baseline so that you know where you are at this time. And then yearly, would you say yearly?
You do it. You need it right before the beginning of each competitive season. And it is extremely important to start doing it in that middle school age, because the growth and development of the brain, the demands that are placed on it in school and home and the practice, there's a lot going on. So it's not mandatory, and it should be.
It should be.
And for those parents out there that are listening to that, it is the best thing that you can do for your child, because you don't want to see them struggling in school and having to repeat a grade because you didn't take care of their brain.
That's right. And when I was playing football, I mean, we didn't have the newfangled helmets today, where it absorbs some of the shock and so forth. We literally had burlap in our helmet. That was what was the protective, agent that we used. And when it got cold, it was rock solid. So you talk about, getting concussed. We were concussed, I think, daily. We saw stars every single day. And you have children. The point is, you have children today, even if they have the protective helmet, they're bigger, they're stronger. You can look at my son, he's a big boy, and the impact is more. And so even though they may have the protective helmets on today, it's smart to get tested this.
And it's being theorized that with all this extra protection now and those extra protective helmets, you are less apt to hold back. You become a human missile.
Right.
And guys are running into each other head first as hard as they possibly can, because if you're wearing that little burlap over your head, think twice, because you're going to be getting your bell on quickly. But if you're not feeling that bell being rung with the super thick protective helmets and the super thick pads, then yeah, it's
our technique was flawless back then. You had to be.
That's a lot of who will end up
right, and it's a lot to say that these repetitive hits, you may not necessarily get concussion, but these repetitive hits that you're taking, it may not knock you out, but it's definitely impacting your brain function.
Your brain does rattle. I mean,
every time you get hit, there is going to be neurological changes.
Absolutely.
And one of the other things that I want to point out is that concussions in female soccer are on the rise to the point where there are more reports of concussions in female soccer now than there are in high school football. Just want to point that out.
It's amazing.
Is that a sport you think of concussion?
Well, what is that? What's the cause of evasion? Is that the headers that they're doing?
It's the headers, and it's also head-to-head with other players.
Right.
So running into your own teammates, running into your opponents, but that repetitive motion of hitting the ball with your head can lead to significant concussions.
And once concussion has been identified as the diagnosis, then it is essential to create a dynamic, customized training program. There has to be a plan. With anything, there must be a specific plan to get the individual back on the field of play, whether it be life or whether it be the actual athletic field or the ice or whatnot. Without that, just spinning your wheels, you're really not getting anywhere.
Now, there's so many people that have come into our office that had a concussion a year and a half ago, 2 years ago, and they're still experiencing difficulties in school. And they get the MRIs, and I will tell you one thing, concussions do not always show up on an MRI. I highly recommend going and getting a brain scan done that will actually be able to pinpoint the exact location of the concussion in the brain. And knowing what area it is, whether it's frontal, parietal, occipital, that will give you the best line of defense to create the most effective treatment program.
Absolutely. Now, Chantea, what are some of the things that you do utilizing live feedback with somebody that has concussion? So they've been diagnosed, they have concussion, you look at their pre-test, the baseline concussion, you see that there.
Yeah.
So you do a post.
Post-concussion test is the first step that we do here. After that, I do a full psychophysiological profile, which measures heart rate variability, skin conductance, which is the sweat, your respiration. We measure muscle tension, because a lot of times if you're experiencing headaches, your muscles are going to be tense as well. So we measure that, and we go from there. So getting that baseline, and a lot of times you're going to find erratic patterns in the heart rate variability and the breathing of someone with a concussion. And then you start to train. You go through the programs of having the person learn the proper breathing techniques. Everyone has a resonant frequency breathing rate. So finding that breath rate, so the average person you could say is 6 breaths per minute. Athletes can be as low as 3 and 4 breaths per minute. Up to someone that's not active at all can be 7 to 8. So identifying what their optimal breathing rate is going to help tremendously in allowing that brain the time it needs, the oxygen that it needs through proper breathing techniques. So that is the first thing that I work on training. Doing that, skin conductance is another one. Learning how to measure and train the body to respond to stressors and lower your sweat levels, lower your temperature when it needs to be, or elevating your temperature. Sometimes you have cold hands and cold feet. It's due to autonomic dysregulation. Learning how to balance that out, being cute, and that's what biofeedback is so great at. It's immediate feedback on how your body is performing.
Right.
Some ways to enhance biofeedback is using audio-visual entrainment, where you wear a set of goggles and you listen to binaural beats, and it helps to get you out of that agitated state. It puts you in more of a relaxed state so that your brain is calm and can process the new information better. Same thing goes for the PEMF. And what that is pulse-electromagnetic frequency. So those are just small frequencies that go into the brain that will help reduce all of the incorrect patterns going on. So it also allows you to put it on for 10 minutes before a session. You can wear it at home. There's an app, use the Bellevue. It's fantastic. So to improve concentration, reduce anxiety, improve sleep. Because that is one of the biggest factors with concussions is you either sleep too much or you can't sleep at all. So helping the client that comes in with sleep issues so that they're getting the right amount that's going to nourish and let the brain recharge is essential. So these are some of the things that I do here in the office that is not your typical standard. Sleep for 2 weeks and go back to school. That's not going to help anybody.
And that is, when I had my concussions, that was the treatment. You went home, you slept, and then when mom or dad woke you up, you had to wake up quickly, all right? And that meant that you had more, I guess, cognition, if you will. So if it took you a period of time to get up, then you would go back to the doctor. There was no follow-up.
So when it comes to nutrition, first test. Always test for success.
You always test for success. You always, if you're not testing, you're guessing. However, in a concussed patient, all right, there's a lot of inflammation going on. There's a lot of oxidative stress that's going on. And so the brain is what? What does the brain consist of? A lot of fat, right? So you want to add in some good fats. So you want to add in fish oils. You want the EPA, DHA. That would be something that you would immediately put in, all right, to somebody who has this, because that'll help bring down the inflammation, all right? Bringing down that inflammation, bringing that oxidative stress is important. Glutathione is another great compound. Although you would have to get it medicinally, but if you can take that as a precursor, that would be a great, supplement. Also, to take B12 is good for vitamins. Turmeric, curcumin is great in bringing down inflammation. Creatine has been shown to help bring down inflammation. When it comes to concussion, vitamin D is important. It's pretty vital for a lot, so vitamin D would be another compound that you would throw in there. Resveratrol is another great antioxidant that you can utilize to help out.
Absolutely. Well, chiropractic-wise, I know you've seen quite a few individuals like that have been post-concussion. How do you exactly look at them and examine and treat them?
And the first thing is go into a specific exam to see really what the discrepancies are. Even if there was a brain mapping done, you know what area it was local brain was damaged. It's still kind of like when someone goes into physical therapy, you have to know where the exact problem is. You have to compare it to someone has a knee issue. The way you're going to, what exercise controls you're going to have to do to strengthen that knee is going to depend a lot on the injury. If it's a torn quad compared to a meniscus area, there's different things you can do, especially on a different timeline and intensity for it. So the first thing you got to do is figure out what kind of issues are we having, where it's going to brain. Is it just all mental cognitive? If so, send them over and do the biofeedback. You start getting physical changes. Like common ones is people can't they can deal with alcohol nearly as well. Or they end up realizing they get a little bit of a tremor. Or their balance goes and tries spinning one direction compared to the other. In a world of both Dr. Dan and myself, we're in the martial arts realm, and being able to have balance in one direction or another is huge. Not only just in martial arts, but most sports, there's some sort of dynamic turn spin, whether it's trying to juke in football, rotate, or do like tennis. So once you figure out what these discrepancies are, you can go ahead and start giving the functional neurology drills to start upregulating and strengthening those areas to get back and perform better. And then when you get back to the baseline testing or the post-concussion testing, we can help guide the way to get better scores, get you back out and play much better. Always dip into the nutritional component as well. Things like inflammation is the first thing, typically one tackle. And then there's the neurotransmitters, is the brain still able to produce all of them. And a lot of times this comes into where memory issues or depression can come afterwards. Because maybe your brain's not producing enough dopamine or acetylcholine that's the case, then there's times to sort of slowly supplement as well.
Yes. And there's tests for that, and then there's simple blood tests for that, and that's the beauty of it. It's quantified. We can measure it.
Right. Yes. And obviously, we'd like to do a lot of proprioceptive work with the individual as well.
Yes. Where are their eyes moving? How are they?
Exactly. What are the deficits? Reprogramming those deficits and training those deficits. Even if they seem basic, they're not so basic in the brain anymore. They're just needing to overcome.
Yes.
Somebody may have problems walking up stairs, getting in and out of the car.
Yes.
There's a lot of reprogramming and corrective exercises that go into the day-to-day functions of people with concussions. I mean, you think of athletes, and we're talking mostly about athletes here, but you can get in a car accident, you can get them hitting your head, getting out of the car, and so a lot of the same principles that we apply to athletes, we do apply to the general population.
That's what I was going to say. Not only do athletes suffer from concussions, everyday individuals. You could be a weekend warrior, you could be on the job and you can get a concussion.
Your children can fall out of a grocery cart.
Right.
I mean,
a simple slip and fall in the winter on the ice, and you're just getting out of your car, and you can whack your head. So athletes, in addition to everyone.
Absolutely. So step one, get a baseline concussion test done. Visit Functionized, and we will conduct that for you. Go over the results with you, and keep it filed and stored for you so we can take a look as you go down the road. Should you be suffering from post-concussion, even if your physician has stated that you've reached maximal therapeutic benefits, and you're still feeling some ill effects, getting headaches, tired, nauseous, difficulty with your memory, come in. It certainly doesn't hurt for us to take a look and hopefully get you back ahead of where you were in the first place.
100%.
So check out the website www.functionized, functionised.com. Hit us up on Facebook at Functionized, Instagram at Functionized. It's pretty simple. Everything's being functionized. Phone number 848-444-9032, and we're here for you, or whatever it takes.
That is correct.
Saturday through Saturday.
We're here.
We're here.
We're here all the time.
Our email here is support@functionized.com. Any questions, comments, you can also leave it. We'll be posting the Facebook feed.
That was our Functionized webinar from yesterday on sports performance after concussion with myself, Chief of Human Performance, also your mad scientist, Jim. We had Beauty Brains Braun, also the Director of Cognitive Performance at Functionized, Chantea Goetz, Dr. Mike, our Chief Brain, as well as Dr. Dan, our Metabolic Nutrition Specialist. As always, visit our website, www.functionized.com. Any questions, comments, always, you are welcome to leave the comments in the section below. DM us, email us, support@functionized.com. And we appreciate those 5-star reviews. Keep them coming. Take that 2 seconds and leave it. Have a awesome day. I'm out.